Hello everyone, my name is Mario Martinez and this is Amateur Medicine. So great to talk to you guys again. I thought it'd be kind of fun to change up the scenery a little bit. I don't really know. Before I even start, I just want to thank our channel members. I wrote them down over here, but it's Always a Montana Girl, Victor Rodriguez, We Suck at Disc Golf, Troy VD, Aaron Rhea, Steven Richards, and Nathan Smith. You guys make it possible for me to buy like energy drinks, coffee, things like that. Definitely lessens the burden a lot, and then with nursing school, so I truly appreciate it. Thank you guys so much for helping support the channel. But I wanted to kind of bring back some things that we're doing right now. So I just finished another test. I finished exam 3 for level 3 for nursing school, where I had to go over intracranial regulation, so things like stroke, cerebral palsy, Parkinson's, seizures, things like that. Very fun. I really like looking at it from not only as a paramedic, but also as an RN. So I find that to be really enjoyable. Learning all the different things like the different medications, the different treatment plans, how to deal with a patient long-term versus short-term. It's all really exciting. Some quick little things like for TPA, it can be administered between 3 to 4.5 hours. They talked about different strokes. So like they talked about ischemic, hemorrhagic strokes, and they kind of also talked about like a tertiary one. So they talked about embolic, ischemic, and one other one I can't remember. I guess embolic, ischemic, and hemorrhagic. There's some weird variation I can't really think of. They talked about how like a lack of perfusion to the brain doesn't necessarily always have to be from a clot, but it can just be from like hypovolemia or like just low blood volume in general. It's very weird. I can't really describe it too well. But I passed the test. That's all that matters, right? So I'm very blessed for that. What else? For TPA, whenever you're doing like a CT scan for somebody who has a stroke, you're worried about if they have a possible hemorrhagic stroke. You can't administer TPA for that. That's for like an ischemic stroke. So you need to do a CT scan without contrast. Then you can follow it up with a CT scan with contrast if somebody does not have a hemorrhagic stroke. It's little bits of information. It's just really cool to see. Just a little bit of like the post-acute care. I don't want to go too into it, but I really like the names like carbidopa, levodopa for Parkinson's. And there's just a lot of really cool little tidbits that I really enjoyed. But that's been really fun, just class in general. Big shout out to the tutoring that they have provided. My tutor is exceptional. But my tutors have always been really good at the Nursing Success Center. They have done a phenomenal job, and I definitely don't think I'd be as successful in nursing school if it wasn't for all of them and their help. What else? My clinicals are very fun. I am learning a lot from my preceptor, and I'm very thankful for everyone that I'm working with. Even my classmates, getting to work alongside them on different floors can be really fun because they all have like their own different ways of doing things. And I feel like I'm in a really good group where we build up each other. And like I can turn over to some of my LVN classmates and be like, well, I really respect you. You know how to do this and that. And I can see some paramedic ones and be like, oh, I can respect you. You've done this and that. And even the students, even the ones that aren't working, I can kind of be like, well, I see where you came from. And like, I see how hard you've worked. And they're all just impressive in their own ways. So I really do enjoy that. My work at the fire department has been really nice. I just swapped from the busier station to the not as busy station, which has its pros and cons. My new captain is really talented, so I'm very thankful to be able to work with him. And my crew seems like they're pretty good, so I'm excited to learn. I've got a really cool paramedic, and I still have my partner Grady, so I'm very excited about that. But the paramedic's really talented also, so I can probably learn some things from him. He does things a little bit differently than I do, but he still gets the job done really well. What else? Work has been good. Again, I swapped to the bigger station. It's been really nice. I have some things in the works, right? I mean, I'm still working on my 8 EMT program. The thing is I want to make sure it's pretty decent and that the test questions are applicable, but it would just break my heart to go through nursing school and fail a test or fail out of the semester, and I'd be like, well, I spent too much time on my test prep stuff and my videos and not enough time on nursing school. So I just mentally, if I have to make the choice between testing and my test prep stuff and all the thing, even though I love teaching about EMS, it's got to come second, at least for right now, because I think it'll give a lot of credibility to everything too. Not only am I a paramedic who's done this, and I've worked at a clinic and done this, and I've also worked as a, what is it called? A paramedic, there's like a term, basically what is it called? I did the job for like a year. I've done some transfers, things like that. I can't think of the term at the time. But then also to be like, oh yeah, by the way, I'm an RN who, maybe I work with pediatric patients, maybe I work with ER patients, I don't know. I'm just really excited for it. I see all your nice comments every single day. I leave my notifications on my YouTube. I leave notifications on Reddit. I have notifications on for Facebook. I get my emails. I check them every single day, especially if anyone has any questions about like the test prep website. Like I'll answer them, and if somebody had any discrepancy or anything, I'll fix it up right away, because I think customer service is really big too. But then the Discord, I just turned on notifications for that, so I'm starting to communicate more with that, which I really enjoy. But there are times where I'll be gone for a couple days, and I'll really only respond to emails. But now I have the notifications on for it. I see all your comments. They like 99.99% of them are all super nice, and the ones that aren't nice, I think they're justified. You know, I think that they have a point. I need to still go back and edit my Crush the NREMT video. It's a really good video. It's helped so many people pass. I get messages every day of people passing using the test prep website and then using the video as well. And so I'm overjoyed that I've been able to be a small part in some people's educational experience. But I'm doing a disservice to some people, because SpO2, I've changed some of my normal ranges just a little bit, where heart rate, it should be 60 to 100 beats per minute. Respiratory rate should be 12 to 20 breaths per minute, and SpO2 should be 95 to 100%. And really, you could argue that you could do temperature at 96.8 to 100.4 degrees Fahrenheit, but that doesn't really make sense to me. Really, 99 plus, you kind of think of a low-grade fever. But I could, well, whatever, I could see it. And then also, like, some people do 96.5. So it's tricky. You know, that's probably the worst thing about putting vital signs out there. That's why a lot of test preps and other websites or videos don't do it, is because they don't want to say a certain set of vital signs and then they'd be incorrect. And then it's kind of like, well, what the heck? Why'd you teach me that? For me, I just have to give people some foundation to work on, and then they can take the good with the bad. But I would like to go in and fix that. One of my coworkers recently was talking about how I can go in and fix it. There's probably a way to do it. I just need to not be lazy and look into. I'm not being lazy. I'm very busy. Some things that I need to do. Okay, I need to make an AEMT test prep. I need to finish that. That's got to be pretty high on the priority list, because I've had so many people messaging me asking for like AEMT content, and I really just don't have that much. What else? I'd love to get started on the paramedic one. That one's way down the line. It's because mine's going to be the best. So if mine's going to be the best, well, then I really have to make sure the quality is up there. And it'll take a lot of time. It'll take more time than I currently have right now. But I'd love to do it. I have the time. It's just time management is really tricky. I have an idea for how I'm going to make this next 20 to 30 videos. I think it's going to be a really big hit. I think it's going to provide different material for different people depending on what you're looking for. I still want to add on to the EMT-B test prep, because even though I honestly, I'm just going to say it, I think I've got like just about the best one in the market. I think we've killed it. I think we've done a great job, because I'm looking at it from like a viewpoint of as if I'm a student. And so I'm very pleased with it, but I still want to add on to it, and I will. But it's got to be lower on the priority. But I have a fun thing that I'm going to start working on pretty soon. I need to make more member content. For my YouTube membership, you guys are so nice. I have to find a way to make it more like, okay, well, now I'm getting this, or I'm getting this. Because honestly, I've really failed to do that so far, just in general. I also haven't celebrated hitting 10,000 subscribers. We're already almost at 11,000 now. I'm extremely thankful for all of that. You guys are so incredibly kind. And it's just a beautiful community. Again, I think we've done a phenomenal job of just, if you have questions, post them in the Discord. People will message them. I have people reaching out to me quite often where they'll say, hey, on Discord, they'll be like, hey, I'm really struggling with the RNstudent. Can I pay you for tutoring, for things like that? No, you don't have to pay me for tutoring. My hours are really garbage as is. But if you have questions for the RNstudent, and if I have time, I've sat with people in Discord chats for like 30 minutes or so, and I'll go over some stuff like, what do you know and what do you need to know, right? Just because I feel like I already have a test prep. If you want to get what I think should be on the National Registry, that's available. I have some YouTube videos that kind of already go over it that I think are good foundational videos, and I think that helps a lot of people. I don't need your money for that. I think it's part of my job as a healthcare professional to I like to just assist people if they ask for help. What does that say? Oh, it's okay. Someone just signed up for the test prep website. I just got a notification. That's pretty cool. Thank you, buddy. That's good. It's great to see. What else? I haven't got to scratch my teaching itch for a bit because I don't have much time to make videos. Even now, this is like my only day of respite. But I haven't worked at Texas EMS Academy for a couple months. Really stinks. I really want to go back and work there because I love working with the students. I love I think every EMS agency, whatever's local to you, whatever's better. I don't have any favorites, but the owner, he lets me embrace the teaching position. He's like, whatever you think will be better for the students. And I love working with the students there. I think they're all like a lot of fun. I get to impart a little bit of my own wisdom to each of them, even though I don't get to work with them as much as I'd like. But it truly is just a pleasure just to work with students. And then I'm very lucky. I work at a fire department, so I work at a day on the engine, a day on the medic unit. Every single person that I see in the community is thanking me for my job, and they're so nice. It's so amazing. I go to teach, and I really do give it my all because I love all the students that I work with. They've all got such a good drive, and so I can appreciate it. And so they just hit me with nonstop, oh, thank you, so nice. And then I go to work, I'm like, oh, thank you, so nice. And I go to nursing, and whenever I do nursing, from 6:30 a.m., because we have a day of data collection where we'll go in, we'll meet up with our potential patient, and I'll tell them like, hey, am I okay? Is it okay if I work with you tomorrow? And I just let them know, from the moment I'm there as your nurse, even as a nursing student, till the moment I leave, I'm gonna be there for you 100%. If you need your pillow fluffed, I'll fluff your pillow. You need extra snacks, you feel like you have pain, nausea, you have some sweat, you might not even notice it, I'm gonna try to bring it up. My instructor's so talented. She really pushes patient advocacy. And I feel like that's something she really imparted on us. And so hey, you know what? When's the last time you brushed your teeth? Let's get some toothpaste for you. Let's get a toothbrush. When's the last time you did some AM care? That's what she calls it. AM care. Let's get a wet rag for you. Let's make sure you're clean. Do you need help with your urinal or anything? And then if I'm able to do anything else past that, any skills, of course, I'm the first one to raise my hand. And I try to do it as much as I can without taking away skills from my classmates because I love them too. They're all fantastic. They all do a great job. They work hard. And so, if I've done an IV or something and someone else hasn't done an IV, then go ahead. If there's a skill there that I want to do, but they haven't done this skill yet, please, by all means. But I just feel very blessed. It's phenomenal. And a big part of it is thanks to you guys. You guys are extremely kind. If you are struggling with the NREMT-B, the AEMT version, the paramedic version, if you have questions about becoming a firefighter, like a firefighter paramedic, you know, if you have questions about going into nursing school, I only know part of nursing school, or just healthcare in general, just send me a message. You know, I promise you, I'm not that hard to find. You can reply in my comments, and usually I respond to them. The Crusty RNT video, there's a ton of comments. It's hard to keep up. Other videos, I always try to keep up. My newer ones, I always try to keep up. Discord, you message me on Discord, I'll answer you. And I'll do the best of my ability, even pay or not pay for, like, if you're working on like the test prep thing. I appreciate it, and I think I do a good service to prepping people for the National Registry. You can still just message me, and I just want to propel as many people as I can, because I used to be a student, I used to struggle, and so I know what I would look for, and so I try to be that person that I'm looking for. What else? I guess I should mention some Discord people too, right? They're so nice. Meow Scenaries just said, let's go, when I said it, passing for my test. Who's put these? Ride or Die and Chokoharo. Who else? I love talking to Cool Breeze. He's cool. First Citizen, you talking a lot. I helped out Gable recently. I'm just looking at some names. EMT, EMPTY. There's also this funny guy who posts screenshots of himself in the worst imagery possible. There's Dan. I like Dan's pretty cool. The EMR person is a little bonkers, but that's okay. We love Cool Breeze, if I didn't already mention it. We're huge Cool Breeze fans. And I've seen this one person who's Para something, and Hayden. So shout out to you guys. So, in general, I'm still pushing for my nursing. I don't want to just be an okay nurse, I want to be a great nurse. So then one day I can spread educational content, as well as for my patients. I think it's overall just going to help my patient care, just in general. So I'm so excited. May, as long as everything goes right, May is when I'll graduate, and I can't wait to jump right in it. I think it's going to be fun. I don't know if I'm going to do pediatrics or ER. Pediatrics, ER, ICU. I'm kind of leaning towards that. Maybe the NICU. I don't know. That being said, thank you guys so much for watching this. This is just like a little update. I am very blessed with just everything in general, and I really do feel all the appreciation and the live support that I get. I'm so thankful for it. Thank you to the channel members. We'll roll over here, right? Thank you to the channel members. We'll put your name over here or something, right? I always kind of get in the way. I always struggle to like put it with everything else. We are going to make some new membership videos pretty soon. I keep saying it, but am I doing it? Well, you know, it's coming. And when it comes, it's going to be like a hurricane. You're not going to get enough of it. If you guys have any idea for membership videos, please let me know too. You know, we can get that up and rolling too. Just not to alienate my current audience, but more so to be like, you know what, this is my way of saying thank you for your loving support. But I appreciate all of it. Just a nice comment, a like, comment, subscribe. We're at 10,913. That's insane. We're very lucky for that. But with that being said, I'm gonna let you guys go. I apologize for not updating you sooner. The reason being is because I made this video, but I did it right before a test, and so I was very somber. I had a really melancholic mood. And so I was like, you know what, who the heck wants to see that? And then I passed my test, and now I'm all up. I'm all caffeinated. All right, see ya.